Hi, this is Dr. Truong. I want to send this video message to all of you, my patients at Gateway Oaks or at Rocklow's Dental. I want us to say hi, send you an update, and also let you know that we miss serving you as our patient. Um, First of all, happy Easter. Did you do something for Easter this time? I know it's not the normal Easter celebration that we will do every year. For my family, we wake up and we bake and cook all day yesterday. Um, and from this quarantine, I have learned to make a lot of new recipe. I discovered a YouTube channel that giving me all this recipe that I have able to make some of the dishes that my mom and my grandma had made for me, and now I'm able to make those recipe to share that with my daughters and my husband and my kids at home. Did you do any new recipe this year? What do you do for Easter? Put down a comment or send me a message and let me know what you did for Easter. Um, and with this quarantine, my sister-in-law has told me that I uh, I had shown the domestic side of me, and which I agree with her that I have. Many of you know me that I work a lot and I'm a workaholic, and I have spent many hours at work. I'm very lucky that I have family members that are very supportive of me, that take care of my kids for me and then do the housework. Um, and now that I have the time off, I get it's allowed me to catching up on some of the work that I had been long delay, and then I have starting some of those projects now that I can't work anymore, or or during this quarantine times. I sent out a text message to all of you, whether you have an appointment in April or not. So let you know that our office are closed for the remaining of April. As of right now, we have no set date to reschedule your appointment as of yet until further notice. In the meantime, if you happen to experience any dental emergency during this closure, I wanted for you to know that I am available for you. You can always reach out to me. I can assess over the phone to see how I can help you to manage it from home, and if you need to be seen at the office to get treated. Um, my goal is to help preventing you from going to the hospital or needing to go to the hospital, so that way we can minimize the risk of exposure for you, and to alleviate the hospital from having to treat dental emergency, so that way they can focus more times on more times and care for those patients that actually contracted the COVID-19, or getting treated those patients that can be treated at the hospital. So what is dental emergency? Um, Dental emergency as if you have a toothache that keeping you up at night, constantly in pain all the time, and you can the pain um, is not alleviated with pain medication. Um, a dental emergency could be you have a swelling, and that swelling is now causing you pain, and is something again can keep you up at night and is constantly in pain all the time. You have um, you have broken a tooth, and the tooth is now causing you having difficulty to eat, and if you can't touch it, you can drink anything, you can everything hot and cold causing you pain. The other part could be your front tooth now broke. That that's no way that you can walk around like a hillbilly and having a broken tooth for the next few weeks, and you may be the essential worker that still have to go to work, and now that you need to get that tooth fixed so that way you can go to work. So you can see that there's that kind of similar things that the dental emergencies in that causing you like pain, swelling, something that is cannot wait for the until we get back to the office in the next few weeks. If you or someone that you know that may experience any of the symptom, if their office is their dentist is not open and not available, and then they can reach any of their office, then you can always let them know that I'm available for them as well. So what can you do to prevent dental emergency? Well, floss, floss, floss. If you don't like flossing before, then now is the time to floss. Since you're not going to see our hygienist for a few more weeks, so that way they can floss for you, this is time for you to start flossing, because once you start able to see my hygienist again, they're all gonna be appreciate that you have been flossing over the last few months, and you're also gonna appreciate them as well, because your gums not gonna be so painful when they go in there and try to clean all those plaques out for you. The other part can preventing dental emergency: brush 2 times a day and at least 2 minutes each time. If if you if you have a night guard, this is the time to wear them. Putting a drawer in a drawer is not gonna help preventing you from protecting your teeth if it's in the drawer. So make sure you wear them. And if you don't have a night guard, just pray very hard, because I'm hoping that your tooth will not break during this time. And then call me if your tooth break in that case. The other part, if you are an ice chewer, and if you are an ice chewer, this is also the time to stop, because the hardness and the cold of the ice, it doesn't go well with your teeth, and it will fracture your teeth, and this is not the time that we want to have a fractured tooth. So basically those are the simple things that you can do to help to prevent you from a dental emergency. So this is the message for you. Make sure you take care. I know there are some of these under this condition. I know there's some of you out there have a lot of anxiety because of the unknown. I know a lot of you are alone out there, and being kind of out there and not able to reach out to people. This is the time to be able to reach out to someone you know. Don't be alone out there. I know it's kind of hard. and I'm a social person, and I love the interaction with people, and this is hard for me to be kind of tied home, not being able to see all of my tennis friends out there, all of the patients, being able to do the normal thing that I normally would do. So hanging there, we're all gonna survive, and we're all gonna go back to our normal routine. You can always drop a comment and let me know if in any way that I can help you. I will definitely try my best to be able to do that. In the meantime, I'll see you all soon, and make sure that learn something new this time. Start doing new project, doing old project, cleaning up the house. Do something different than what you were not able to do before. Like I always say to myself, I wish I have more time and to do things that I wanted to do. So now that I have the times to do the things that I don't want to do before, now I have the time to do that, and I enjoy those moments, but I also enjoy looking to going back to work soon. Um, if you can need to get a hold of me, to call me. All right, take care, everyone.